So this is the Healthy Town, Traverse, Michigan. Traverse City, Michigan, excuse me. And prevention is our future. And I want you to hear from each of our panelists for a little bit about what they actually have done and what they're going to be doing. And then I would invite all the students, this is kind of a dangerous sleepy time after lunch, to be thinking about one question from each of your table, because I think we'll have time and look forward to your questions. All right, let's see. First, let's start with, where is Kathleen? Ah, there you are. Kathleen LaRaia?
LaRaia.
LaRaia. Welcome.
Thank
And Kathleen is the Executive Director of Munson Healthcare Oncology Service in Traverse City, Michigan. And she earned her Bachelor of Science in Occupational Therapy from Wayne State in Detroit and a Master of Science in Health Service Administration from Central Michigan University in Mount Pleasant, Michigan. She is responsible for building an integrated network of cancer care within the Munson Healthcare Organization. So, my first question for you is the cancer burden in northern Michigan is high. 4 of the 5 counties with the highest risks are within the community served by your healthcare system and family cancer center. So could you tell us a little bit about what you're doing to reduce this risk?
Yeah, so we're rural healthcare, as Kelly had talked about earlier. So we service 30 counties, so northern Michigan and then part of the Eastern Upper Peninsula. And so as the cancer burden in the state of Michigan is analyzed, we discovered that the top 4 of 5 counties in the state of Michigan fall within our service area. And so why is that? And so we're so fortunate to have our researchers, community researchers in our program, so we're still looking at that. But our doctors and our administrators a few years ago decided that we had just sporadic treatment throughout all of these counties. And so we really wanted to create a hub and spoke model of care and developed a brand new cancer center that's been open 4 years. But my philosophy when I got there was I just didn't want to be the treatment center, that 42% of cancers are avoidable, preventable. So what could we do on the screening part, the prevention part, treatment, and then those that survive? So we've been partnering with a lot of integrative therapists within our city so that we can have symptom management for patients going through treatment. Some of our treatments are very toxic, and so they might get numbness and tingling, cancer fatigue. So what are we doing to help prevent that? But more importantly, we have health disparities in our communities that are typical. Smoking is very high, obesity is very high, and just having access to screening. So we've developed actually some funding to help support our population is either affluent or indigent. And so we've got that wide range there. But there are patients that have to travel over 100 miles to get care. So we have gas cards for folks. We have a Munson Manor that's a 30-bed facility where people can spend the night and have their treatments. And we just recently added 4 RV hookups for those that come with their RVs, and then their families can stay with them. So trying to look at just different ways to access, to have people have access to care. And then all of our little hospitals, so Munson's part of a 7-hospital system, which is a 400-bed big hospital in Traverse City. The rest of our hospitals are as small as 25 beds. And so we got all of those CAT scan machines to be certified to do low-dose CT scanning. So that's for patients or people 55 to 74, 30-pack smokers, or have quit in 15 years. We screened 4,800 patients and found 54 stage 0, stage 1 cancers. That's a very high rate, but stage 0, stage 1 can be curable. But what do you do if they're still smoking? There wasn't much smoking cessation, so we had to go around and develop facilitators to do smoking cessation as well. So that's a few things.
Thank you. I want you to, again, think of your questions. All right. Next, I'd like to introduce Ty Schmidt, who's is a master in physical therapy. Is that correct? All right. And who is the co-founder of Norte Canadian import. Ty came to Traverse City in 2006, along with his wife. They founded Norte in 2013 to advocate for more happy, healthy, strong young people. All right. My question to you is, how can we help prevent obesity, cancer, and other chronic conditions through exercise and organized activity in the community?
That's a great question, Jan. Yeah.
Because he wrote it.
Well, first, I just want to thank Bill I was here at this workshop 2 years ago, my third trip to DC 12 years ago. I was here with my dad at NIH, who passed away from melanoma, last-ditch effort. So it's trip 3 to DC. I'm proud to be up here on the Healthy Towns panel because I think a healthy nation is built on healthy towns. A nation with less cancer is built on towns with less cancer. So, as a physical therapist, physical activity, moving more, is a passion of mine. I spent 18 years in the PT clinic treating disease and dysfunction and wondered if there's a better way because once you make habits, they're really hard to break. And so my wife and I, who's also a physical therapist, got a little bit frustrated with our neighborhood schools wrapped in car lines and did something about it. And so we were working hard to work on getting kids moving as part of ordinary life, nothing against sport or recreation or exercise. But I believe if you walk and bike as part of ordinary life to the places you normally go, to school, to library, to the park, to your buddy's house, we all the benefits that come along with that are important. Just like Dr. Isaac speaks about healthy weight and obesity, this is what it's all about. And teaching kids early on when they're 3, 4, 5 years old that it's perfectly normal to walk a quarter mile to school, that it's healthy, to convince mom that it's safe and not dangerous. So that's what Norte is doing. We're just implementing a lot of evidence-based strategic work designed around people, specifically young people, who will then grow up to be adults where moving, again, as part of ordinary life, is just normal. It's healthy, it's convenient. So Norte's work, although we're in a small town in Traverse City, we lots of inspiration going around the country. So, and I look over here at some of the high school students in Virginia, and I ask you about how accessible your school is. How accessible was your elementary school? Talk about, is there policies in place, whether it be at the school district or community district, where they make walking, biking easy? And again, normal, not putting barriers in place. And we think of it just as a simple thing that, well, kids are getting exercise, but the ripple effects that happen when we make it safe and convenient for kids to get to school ripple through the neighborhood, ripple through the town. And we know that adults who move more as part of ordinary life have a healthier weight, therefore less cancer. And I look forward to more questions.
All right, thank you very much. All right, we'll go to this side of the table, and we'll go next to Kelly Hirko, who is Dr. Kelly Hirko, PhD, MPH, Assistant Professor, Department of Epidemiology and Biostatistics, College of Human Medicine at Michigan State University. And so my first question for you is, we heard a little bit about how the rates of cancer differ between rural and more urban areas. Can you talk a little bit more about that and some of the preventive strategies we might consider in that challenging rural environment?
Sure. So cancer rates associated with modifiable risk factors like tobacco use and HPV and preventive screening services for colorectal cancer and cervical cancer, those cancer rates are higher in rural areas. So the role of preventive services can make a huge impact in reducing rural cancer disparities. Some of the national data suggests that cancer mortality rates in rural areas are 10% higher than urban areas. So we can't just focus on the preventive piece, but also think about secondary prevention, as I call it. So what you can do to prevent recurrence after you are diagnosed and improve your long-term prognosis. I kind of talked earlier about all of the factors that contribute to this, and rural areas are particularly susceptible, higher rates of poverty, lower educational attainment, an older population, and then a lack of healthcare access, and that's a really critical issue that potentially broadband internet and telehealth can address. Some of the challenges, though, with studying rural cancer disparities. Most of the academic institutions are located in urban settings, and there's not as many researchers based in rural settings. So I feel very lucky that as this model from Michigan State to place researchers in the community, I don't have to necessarily work to create relationships within the community because I'm there full time, and I understand the issues that are affecting our patient population. As Kathy mentioned, we have people traveling over 100 miles each way to get their cancer care. And so we need to think of unique solutions. We can't just take what's worked in the academic centers in urban areas and translate them here. The other thing I want to point out is that of the portfolio for NCI, for National Cancer Institute's funding, only 3% from the last 5 years went to rural cancer projects. So we really need more funding in this area. And it's more of concern with the new budget for 2020, where NCI took an $897 million cut. So funding for any cancer research is really getting hit, and we don't have enough to really make progress in this area.
Thank you. Thank you very much. Last but not least, my Stanley, Communications and Marketing Manager, Traverse Health Clinic. And let's see, my first question for you is, as a community health center, in what ways is Traverse Health Clinic working to engage its community that go beyond providing direct healthcare services?
So we really try to think about the community in our community health center. And so we want to engage our patient population in efforts where they can take some agency over the things that affect policy that impact their lives directly. Next week, the League of Women Voters is doing a voter registration drive at our clinic for our patients. We recently received a grant to help with census engagement and education for our patient population. So as an FQHC, 51% of our board is made up of patients. And last summer, one of our patient board members said, what are you going to do to make sure that the people who come to this clinic know about the census, understand its importance and impact, and complete it? And for the first time, the census is going to be, their goal is to have 95% of the census completed online. Well, broadband internet access is an issue. A lot of the households in our area do not have it. So another option is the phone. Well, how many people still have a landline? If you have a cell phone that has a plan with minutes, you run out of minutes every month, you're not going to stay on the phone to complete the census. So, those are some high-level things. But then in terms of what we do with our patients, we provide transportation assistance, gas cards, bus passes. We work directly with our local bus provider, Beta. When we first moved into our facility, the bus stop was across a busy 5-lane street. There was a crosswalk that ended in an earth berm. There was no sidewalk. So we reached out to Beta and asked them if they could move that bus stop directly into our parking lot, because so many of our patients rely on public transportation, and they did that for us. We really are trying to remove obstacles to care as much as we possibly can. We also, one of the really exciting things that we've been part of for the last 3 years is a fruit and vegetable prescription program, and that's a partnership with an organization called Shape Up North and the Michigan State Extension. And that program allowed people who had a chronic health condition and another factor that put them at risk to attend either cooking classes or education sessions that were put on at farmers markets. And they could earn up to $100 in tokens to be redeemed for fruits, vegetables, fresh foods, but also seedlings so that they could plant and grow their own produce. And this program has been really, has had a huge impact on people's comfort with shopping at a farmer's market, which can be a little bit intimidating if you've never been, and it can be, frankly, be a fairly affluent group of people who tend to shop there. And it also improved the amount of fruits and vegetables that they were eating on a regular basis. And if you think about it, if you've only really encountered grocery store produce or canned produce or frozen produce, if you don't know what to do with kale, if you see it and you know it's good for you, you're not going to bring it home. And so having those cooking classes so people could learn how to actually prepare those healthy foods in their own homes, that was a huge piece of that program. And we're excited to be part of that again this year once it gets to be spring and summer.
Thank you. I think if it's okay with you, I'd like to open up to some questions. Right here, could you just tell us your name and where you're from?
Okay, so my name is Casey, and I'm from Monticello High School in
So it's 30 plus minutes to get to school for me. So how would like walking to school, like you were talking about policies and stuff like that. So like what? That's a good question, Casey. And I think there's with open enrollment and school of choice, not all kids live within a half mile of their school anymore, and we get that. But it's really thinking about how can we make part of the trip, and I don't know whether you bus or then walk or how you get to school, but we want to provide solutions for the majority, right? And so we think neighborhood schools are important. We know that kids arrive from all over the place, but in this culture where movement is basically stripped out of our day-to-day lives now, where we sit more, we screen more, there's an opportunity to at least think about how can we empower kids to learn the skills, because it's more than just getting themselves to school, right? They're going to grow up. They understand that they have independence with mobility. Their mom's not just an Uber driver. They don't need to be delivered like a FedEx package from here to there. So it's not just about getting to school. It's what that leads to down the road.
Great, thank you. Yes, please.
I have a question for you. Our demographics, we live in suburbia, Northern Virginia. Most of us live in, large plots of land, 100 acres plus, a lot of us do. What are the cancer rates? I've heard a lot of talk about urban and rural, but what about suburbia?
Yeah, it's a good question. So one of the things that I'm currently working on is trying to understand heterogeneity in cancer rates within both rural and urban settings. It's really difficult to define rurality, especially when you're thinking about what are those drivers of the disparities. There are over 15 federal definitions that are currently used to define rural areas. And one of the current pushes, at least from the NCI, is to use more of a continuum. So there's something called the Beal codes, the rural urban continuum codes. And so there you can piece out those suburban areas. So it's a coding system from 1 to 9 that goes from more urban to more rural. And so I'm currently working with a group from the Society for Behavioral Medicine to look at how those codes impact health behaviors. And that way we can provide more targeted interventions. So for example, in our region, as Kathy alluded to, we really have a bimodal income distribution. We have a lot of people on the higher end, but we have a lot of people on the lower end. We don't have as many people in the middle. But we're all considered rural. And our region is very large. And so we can get some funding for the rural settings, but it might be targeted in Traverse City where it's not as needed as it would be 20 miles outside of Traverse City where the main hospital is, where it's even more rural. But right now, because we usually rely on the rural-urban dichotomy, we're not targeting those areas. And so I think using more of a granular approach in thinking of the rural-urban continuum instead of focusing on the rural-urban dichotomy is going to be important so that we understand the suburban, the different levels of urban and rural, and that will inform our understanding of the determinants of disparities as well. So it's work in progress.
Can I add to that?
Please.
I guess I would just add another component to that, and it's about screening. Whether you're in a rural community or an urban or suburban area. I came from the Detroit area, and our African American female population were dying of breast cancer at a higher rate than the nation. And we developed a mobile mammography unit to bring into the city, and I still couldn't get people to use that because there was a fear factor. So there's also that behavioral component of how do you reduce that fear to get screened so that then we can find out. So whether you live in an area that has higher risk or not, it's still trying to get people to have the mammographies that they need, the colonoscopies that they need, the lung cancer screenings that they need.
Thank you. Please.
Okay, so in thinking about the fact that exercise is an important factor in cancer prevention, and talking about, for example, rural schools where there's really not an opportunity to walk to school because it's fields and no sidewalks, and then in addition you have an education system that's taking minutes away, it seems, each school year from the time that elementary children are allowed to have recess or even PE classes. So what types of public policy things are being done to address exercise at that level, kind of when kids are still young, and what is it that citizens can do to help reverse that trend?
Yeah. So we partner with 31 area schools, many of which are rural. And just because they're rural, obviously there's challenges, but it's, again, not impossible. And we don't expect any kids to hop on the the county highway and walk 14 miles to school. But again, school-based programs, talking about mobility, independence, the skills, and you ask about policies. There's wonderful policies happening across the U.S. You just go to Safe Routes Partnership. There's all of these policies that are easy to hard in implementing because you're right. PE is being stripped, recess time being stripped. Teachers have a million things on their plate. Principals don't have time for it. And I'm just an ordinary dad citizen who saw something and offered to help. And I think like that's what each single one of us can do, whether they're a parent or an alumni. What can I do to help? Talk about access, talk about connection. Same thing with PE teachers. We make friends with the principals first and the PE teachers second, and because they believe it and they understand like these skills. Nothing against baseball and soccer, but mobility skills where they learn that it's normal to get themselves to the places they need to go transfers to adulthood. We know that. And I will just give a plug to the CDC. Just came out with this really cool active people, healthy nation, 8 strategic steps to integrate movement. And I would just really quick, Casey, Google CDC, active people, healthy nation.
Thank you. Yes.
With the cooking program, it does seem like a really great solution to that problem. However, I know that this is the first time I've heard of it. What are you doing to branch out, and what, places are you oriented and reaching through this program?
So, to be perfectly honest, the program in Traverse City is modeled on a program in Washtenaw County, which is Ann Arbor, U of M area. So this was something that we saw and our community saw that was successful elsewhere and moved it up to our setting. And so our health clinic is one of 3 primary care providers in our area that is reaching out to our patients with this program. I would love to see there be more mobile farmers markets. I know Benzie County, which is just outside of our area, just to our west, actually has a mobile farmers market that goes around and really the idea is to meet people where they are and bring that to them. The challenge with the program for a lot of our patients, since I think earlier I talked about the neighborhood that we're in, technically, we have 2 sites for the farmers market in Traverse City. They're both, quote unquote, across town. Traverse City's not a very big place, but psychologically, there is a challenge for getting people to go from where they live and where our clinic is to those locations. And there's also issues with mobility, but we do have a good public transportation system. Norte is doing a great job about making our city more walkable and bikeable for everyone. And so that's a great thing, but that is something to consider, that where are the farmers markets happening relative to where the people who are being outreached to live and how to bridge that gap. So that's a great question. Thank you.
Let's go right here, Fred.
It really is great work that you guys do in Traverse City, but how can we look at that in a macro level and bring the research and findings that are happening there to a national scale, and what can students and people across the country do to help you guys in that effort?
I just want to make a comment about obesity and just healthy eating. And so we experimented with a program at Munson Hospital because unfortunately many of our healthcare workers are obese as well. And they work 24-hour shifts and they don't have access to good nutrition food. So we started a traffic light program so that at least when you're scanning the cafeteria or when you're hungry, you can have the red, yellow, and green dots. And so you kind of know that if I grab that red dot choice, it's probably not my first best choice. And so now we're trying to partner with our schools to have better foods in the schools, but then to have that red, green, yellow dot system as well. And that you can even do that in your own home and challenge your siblings, and what your choices are to eat or your buddies.
I'll just say there's a whole area of research now on dissemination and implementation science. And what that is trying to do is to take these evidence-based strategies that we know work. There are so many resources out there that have been tested and shown to be effective, but they're not put into clinical practice. And so that's a whole science to understand how to best implement them, but there are a lot of resources that you can find. And I think as a group, in Traverse City, we should focus on how we disseminate the results of our programs, because getting those evidence-based strategies out there can then be used to test the implementation on a broader scale. And part of that needs to be tailored, because you can't just take what works here and think it's going to work in your community. You have to engage the stakeholders in the local environment to understand the barriers to that strategy in that region.
Thank you. Right here. Oh, I'll come back.
My question kind of goes a little bit off of the last question. It seems like in Traverse City, these programs have been so widely successful. And I'm wondering if there's something that you attribute that to specifically in your own community that might make the programs that you created more successful than on a macro level nationwide. You were a little bit saying how it would have to be tailored to different communities, but do you see something specifically in your community or some part of that that could be expanded, or how, and also where are you guys getting the funding for this? That's another big question that I had.
Who wants to try that one?
I'll tackle it a little
All right,
bit.
go
Traverse City is a cool town, but there's nothing special about Traverse City, and nothing what we've done, I believe, can't be replicated elsewhere. When you engage and you inspire people who care, including young people. So Norte has a youth leadership council, and just to your point, I think we need to listen to our young people, give them a stage to talk on. There's nothing more powerful than a young person getting up at a city commission meeting and making the case for their school to be more accessible, connected, talk about equity and transportation, and that link to health. So we base all of our stuff, again, on science and evidence and what works. We're also not afraid to try things and experiment and look for things and pivot to what works, because although, again, every town is unique and different. So whatever works for your town, my only advice is to do something and to try something.
Regarding the funding part, I'll just speak to the food prescription program, because Munson Healthcare and Priority Health, which is an insurance payer in the state of Michigan, they partnered together to try and put forth some of that. So some of the health insurance plans are obligated to do some community work, and that might be a place to tackle.
I think also, you can link priorities. So, for instance, myself and the other epidemiologist who's based at Munson Medical Center in Traverse City realized that hospital readmissions were a huge issue, and that's not a unique problem to Traverse City, that's nationwide, and hospitals are now getting dinged by Medicare and Medicaid. A lot of money is being spent to try to avoid these readmissions, and so working with my partner, we were able to get a grant to look at food as medicine and how we could deliver nutritional services after patients left the hospital to see if that reduced hospital readmissions. So if that we can show that program, and we link these patients to Meals on Wheels, existing community programs after our initial medically tailored meals are delivered, if that program is cost effective, then it could be sustainable, because the hospital was already spending money on these readmissions.
I think Ty had a question here in the back. Not Ty, but that's Tim. Did you have a question, Tim?
Good?
Okay, good. Okay. I did want to jump in on what Ty was saying, because I was thinking about Ty and looking at Tim one of those days. And, Ty says, yeah, I can do it, we can do it, you can do it. And I just want to back up a little bit. These people are extraordinary, and they have been dealing with some very serious public health issues in Traverse City. Why we hear about tourism and affluence, we also know that they deal with some very cataclysmic public health issues. And that's why this year Less Cancer called them Healthy Town Traverse City, because they've done extraordinary things to turn Traverse City around. And so we're not starting out with a community that's got it all buckled up. And they've done great work. And I just wanted to jump in on that before I let it go. You might want to wrap this up, because we're running a little behind. Thank you.
All right, then. I think that I want to thank our panel.
Thank you.
Thank you.
Okay.